welcome to my 517 Follow Friday series. Today, I have the pleasure of talking with Dr. Andrea Herrst. Andrea offers her patients primary care chiropractic medicine with a focus on women's health and pelvic rehab. Thank you so much for joining me today.
Thank you so much for having me. I love chatting, with people who are awesome at what they do and sharing how I can also be a part of that picture. So I'm so thankful that you extended this invitation.
So you have a variety of some pretty unique services, and I think there's so many women that could benefit from a lot of these services, and they just don't even know they exist. So can you start by just sharing, how does somebody get started with you and learn about all of these services that you offer?
Sure. So I think a major way that people find me is because of my background as a chiropractic physician. So I've been in practice since 2007 with, that's my doctorate. And so, people would maybe come to me because they're experiencing, pelvic pain after a childbirth, or, headaches and shoulder tension because they're up all night taking care of sick children. Or, they're trying to incorporate a new fitness plan to their lives, and they're just not feeling their best selves. So I think that's a lot how people find me as they think about chiropractic care for taking care of joints and muscles and nervous system, and so then they're looking in that direction. And then they get to figure out that I really practice very much more holistically, and incorporate things like homeopathic remedies, Arvigo techniques of Mayan abdominal massage that can help with, digestive complaints like constipation and IBS and painful menstrual periods. I also teach my patients emotional freedom technique, or tapping, that can help with pain and anxiety and depression and like a whole host of other things. So I have a lot of different tools in my toolbox and really try to cater to the individual person in front of me. I love to say, I don't do cracking. There's not like the 3-minute crack kind of visit when you come to see me, because there's no cookie cutter recipe for how to take care of you as an individual, right? Like, I need to hear your story, hear what's making, your days more challenging than you want them to be, and what your goals are. So then we plot a course together, how we're going to help you get there, and then bring in other people as necessary. Like, I'm only one person. I can only, be a subject matter expert in this. And so, if we need to add acupuncture, if we need to send you for physical therapy, if we need to, get a coach on board to help you, then we're going to bring in some of those other pieces and parts to help you feel awesome. And so I like to kind of think of myself as someone that helps navigate all of that and kind of put those pieces together for people.
I love that. I didn't realize that you kind of collaborated so much with other professionals.
Oh yeah.
I think that's great. You also mentioned the cracking thing. I definitely have always thought that, if I go to the chiropractor, I'm only going to feel better if there's all the loud cracks everywhere.
Oh, sure.
I've been to a chiropractor before, and I didn't feel like I really got that. Well, I don't feel like I really got cracked, but I just didn't walk away from it feeling really any different. So it sounds like having that focus on the whole person and all of the other things that I might need is really what makes the difference.
Yeah, I think that's what I hear from a lot of patients, is just that they want, everyone wants to feel heard, right? And so feeling that they had enough time to express what they needed to, and then, that there was something that was done that helps them reach a different point, and that it's efficacious over time too, right? So I think that is a difference for how I practice.
Right. So you mentioned pregnancy, and I know that you do different things with pelvic health and pelvic floor dysfunction. I've seen some stuff online that you're doing with one of the other professionals in one of our networking groups. So talk a little bit about that. And is it something that you address during pregnancy or after, or both?
Well, it's really before, during, and after, because thinking about becoming pregnant, you want, to make sure that everything is working at its best, right? So that you can have an amazing pregnancy let that baby grow and develop as well as it possibly can and have a great birth and then a postpartum. So I think like always having a plan, like for whatever, right? Like, and that goes back to what you do in terms of like setting up a plan so that your life can function. If, you know, something happens to you or, you know, you're not here anymore, then you have a plan in place. And so for people who are considering adding a child to their family or adding another child to their family, having some pre-pregnancy care can really address things. And that's especially helpful for the person who has already had a child. And maybe, you know, their past pregnancy was challenging, or they had a hard birth, or maybe they had a great experience, but they're still just feeling like off or different. Right. And so pre-pregnancy can be really helpful. And then during, you know, like it still really burns me when I hear people say like, oh yeah, you know, my obstetrician, you know, my OB said that pelvic pain will just go away once the baby comes. And, you know, they're at month 5. That's really hard to hear as, you know, a person who's not feeling that great and, you know, is maybe managing 1 or 2 or, you know, multiple other children, or has never experienced this before ever because it's their first pregnancy. Right. And so there's so many things to do during pregnancy that are really safe, right? You know, and that's the great thing about chiropractic care, along with the other techniques that I practice, is that it's all very, very safe for the person experiencing it and for a developing baby. So I always like to toss that out there because sometimes, you know, we want to protect our pregnant people, right? Like they're growing a new life. And so we want to like nurture and make sure that they're safe. And sometimes like if your experience of chiropractic is like, they're going to get twisted and cracked and like, oh, like, why would you do that to someone who's pregnant? Like, well, that's not how pregnancy chiropractic care works, or, you know, cranial sacral or Arvigo or any of the techniques that I use to help a pregnant person feel great. And then afterwards, for sure, you know, like the standard of care around the rest of the world is that immediately after, within the first 4 weeks of childbirth, you're getting some kind of pelvic floor rehab. You're seeing a physical therapist. You're seeing, you know, a chiropractor. You're seeing an osteopath. You're seeing someone to address pelvic floor health. That is not the case in the US. No. It is hopefully starting to shift, maybe minutely. You know, and I think that just speaking it into the world is making people aware that like, that didn't happen for my pregnancy, you know, and so we then are sharing that with the people that we come into contact with who are pregnant now or who are thinking about becoming pregnant. Then they're going to start that conversation with their birth provider and say, what's my plan for postpartum for taking care of my pelvis? And then it's on their birth provider to make a plan with them. Right. So, you know, I think just starting that conversation is helpful.
Yeah, I feel like the standard here is you go in for your 6-week follow-up. And maybe there's a conversation about some Kegel exercises or something. It really does not, maybe not even that, but it doesn't go beyond that.
No, it's usually, let's talk about birth control. And good luck to you.
Yeah.
See you later.
I really wish that I had met you 10 years ago, because and also just because I have other girlfriends who had similar experiences, but, you know, I had an unplanned C-section with our oldest, and I don't think it was necessary, but I didn't know how to advocate for myself. And then we ended up getting a doula for our second and third, and I had a successful VBAC, and that was huge for us. It was amazing. But I feel like if I had gone through something with you, some pelvic floor rehab, that probably would have further helped my ability to have a VBAC. And I know there's a lot of people out there who have had difficult births, and that's just got to be something they need to know about.
I think you really said something key, is like an advocate, whether that's an advocate for yourself or there's someone else that you're seeing during your pregnancy that helps advocate for you and like gives you some of those questions and, you know, just supports you in the fact that asking those questions is okay. And that, you know, having some kind of plan is all right to do. And so I really, I just had a home visit on Friday with a patient who gave birth on Monday. Because if that is easier, and sometimes it really is for, a new family that has other children and they don't want to be traveling with a newborn in the car, then I offer that as a service to my patients. And so, just partnering with that person to say, like, here's things that have been successful for other pregnant families that I've worked with. Have you thought about this? Has anyone brought it up to you? So that, you can get the support for this amazing event that's also like the hardest physical thing that, a person can go through.
Oh my gosh.
And then have to recover from, right? Like,
Right.
and I think that's the other thing about our, our culture, our country doesn't really support the new parent and taking the time to recover from, doing a marathon on top of a triathlon on top of not sleeping. We just don't do a great job of supporting families in that transition of adding a new child, and whether that's through, paid time off or, follow-up medical care or what have you. We just could do a lot more.
So much more. Yeah. So kind of spinning off a little bit of your pregnancy and aftercare, you mentioned the abdominal massage. I can't remember how to pronounce it, but talk more about this, because when you first told me about it, I was kind of like, this is weird. Somebody's gonna like rub my belly, and I'm self-conscious about it. So talk about it, because I feel like it's one of those things that maybe people will be put off by and uncomfortable about, but if they know more about it, they are going to be more likely to take advantage of those benefits.
Totally. And I can very much, attest to that fact, like personally, like I didn't necessarily want someone like looking at and or touching my belly. And so I've known about the Arvigo techniques of Mayan abdominal massage since I began in practice. I was not personally trained in them or, providing that service for patients, because I had great referral partners that I would send to for that care. And then they would send back, and we would, continue on with the rest of our treatment plan. Right. When we chose to relocate from the West Coast, I lived in Oregon for 15 years. When we chose to come back to mid-Michigan to be closer to family, I really tried to wrap my mind around the fact that I wouldn't be able to do internal pelvic floor rehab work anymore. That was part of the scope of practice for chiropractic physicians in the state of Oregon. It is not for, chiropractic physicians in Michigan. And so, I had initially thought, like, it is within the scope of practice in Illinois. So, Chicago's only 3 hours away. Maybe I'll just go there a couple times a month and like serve people there. Maybe I'll go to midwifery school because I'm interested in birth, and like maybe then I could incorporate it in that way. Maybe I'll like become dual degree and become a physical therapist, because then I could do, and there was a whole host of reasons why I didn't pursue any of those pathways. And then COVID happened, like it happened for everybody. And I was like, you know what? I think that the Arvigo work is really going to help me achieve continuing to serve people in pelvic health ways that is not internal work, because it's all external. It's all on the outside of the body. And so I started looking into becoming trained, and then I pursued all of the training with them. I've completed my advanced practice certification with them as of this past fall. And that what the work really does is help optimize how your internal organs in your torso function by sending more blood flow there. So we're delivering nutrients and oxygen and all the things that those tissues and organs need to work well. We're taking blood away from them. So the waste products and all the junk that gets made from your organs functioning gets processed and eliminated. We're really ramping up how your lymph system works, right? So we have arteries and veins, and then we also have lymph vessels, and those carry the rest of the cellular garbage away. And they also carry your immune system. That's the primary way that your immune system is getting around, is in your lymph. So if your lymph is kind of stagnant, one, you're going to feel puffy, but two, you're not like circulating your internal defenses very well. So Arvigo work helps move that around. And then nerve flow. I think a lot of us have this idea that nerves in our body are like wires in the wall, right?
Mhm.
That's kind of the imagery that I think we've been kind of
Right.
fed through our education and whatnot. That is not true. Our nerves are more like fluid-filled tubes, and they're sending, neurotransmitters, they're sending electrical impulses. And so there needs to be flow in those fluid-filled tubes for your
Okay.
nerves to function properly, your brain to send a message to your digestive tract, to your uterus, to your prostate, whatever, so it's functioning correctly. And then energy flow, whatever you call it, whether you call it chi or ki or chulel, which is the Maya word that comes from the Arvigo work, we have energy that's flowing in our body. There's many, medical systems around the world that acknowledge that. And so it just helps that move better. So, common reasons that Arvigo work would be indicated for someone, like I mentioned before: constipation, painful periods, fertility problems for men and women, because again, we want those systems of flow delivering nutrients and oxygen and all the stuff to those organs. Constipation is a big one. I also see so many people for bladder problems. So whether that's incontinence or, pelvic organ prolapse, their bladder is prolapsing and kind of causing a bulge in their pelvic floor. Irritable bladder, where it always feels like maybe you need to go. So those are all, there's many more reasons why Arvigo would be indicated for someone, but and everything is covered that we're not working on, right? So I think that's another thing that I hear from a lot of people is like, well, what are you going to see? I don't know. And so we're really only exposing the torso,
Right.
and everything else is covered. And we're only exposing it for the amount of time that we need to have hands on. There's quite a bit of the technique where you're completely covered with sheet and blanket. And so, because there's other movements and there's other stuff that's included. And so, your body is an amazing thing. It's gotten you to this point in your life. Your torso and your belly is only one part of it. And it's a part that is neglected for many, many people. And think about what those organs in that area of your body are doing. They're sustaining you, right? They're processing all of your food so that your brain can function properly and get nutrients, right? They're eliminating waste so that you're not becoming toxic and building up with all of the garbage. They're maybe growing a family. And so these are like really important organs in our body. I think it's hard because I think as Americans, we kind of really only prize our brain, and we like maybe think about our heart sometimes. And the rest of it is just guts.
Stuff.
So it's just in there, and it's kind of maybe gross, and let's like not talk about it. But really, if they're not functioning well, then how can we imagine that the rest of us is going to function well? I just finished reading, my son and I just did the Battle of the Books through the Delta Township Library and the Grand Ledge Library. And one of the books that we read, which was a great book for middle grade readers, it's called The Lion of Mars. And one of the characters, one of our questions was, what is the best piece of advice that one character gave to another? And what quote, what book did this quote come from? And it was like, the best piece of advice for your life is like, you need to have the skill of unclogging the toilet. And right? Like that is really good life advice.
It is.
Because if you can't unclog a toilet, you're going to have big problems.
Yeah.
And so, thinking about the Arvigo work, if your plumbing is not functioning well, there's going to be problems. Just like if your toilet was clogged.
Yeah. When we talked about this before, you also, I forget how you described it, but you talked about how when we go through pregnancy, that area gets stretched and pulled and oversensitized, desensitized, all these things. And do you know what I'm talking about? Where you talked about like you lose this connection with that part of your body, and you like really spoke to me when you talked about that. Can you elaborate a little bit on that as well?
Totally. So that is definitely something else, that I talk with many patients about is sometimes, especially in a pregnancy, and if you've had, multiple interventions, like during your pregnancy, during your birth, whether that's like repetitive ultrasounds, or you've had to have like an amniocentesis, or you had a cesarean, or you just had like lots of things with a vaginal birth. Sometimes we just kind of want to turn off being aware of anything that's happening there. And especially if there is a lot of people involved, right? Like our sense of like protection of this vulnerable area of ourselves has kind of just been blown out of the water. And so we're like, you know what? Whatever is happening there, I don't feel it. Like, and I have patients that come in, and they're like from below, I'm touching myself because I'm that kind of person, like, from below their rib cage here to like the top of their thigh, I can touch it and poke it and, and they're like, I can't feel that. And because they've just really like, they can, but they've just consciously chosen, like, I'm just not going to participate in that because it's challenging and there might be trauma that's, wrapped up in it. And so I think that the Arvigo work is also such a really great way of, again, kind of reconnecting with this really vital area of our bodies. And that can be for so many purposes, for improved digestion, for, better just like hormonal health, and, also just for a sense of like how I am in my own body. And that can also be our relationships with our people around us too, because if you're like, I don't know how I feel about that, like, I'm just kind of turning this off, then that can be a message that we're transmitting to other people around us of like,
Right.
I'm just not going to participate with this. And so maybe you don't need to either,
Yep.
So.
Interesting.
Yeah.
Okay. So there's two more things I wanted to ask you about. One is the homeopathic work that you're doing. And then the other one is something I had no clue that you even offered, which is stress management coaching. So I saw that on your intake form. So can you talk about both of those things and kind of touch on the highlights of it?
Totally. So highlights of homeopathy. So homeopathy is a whole encompassed system of medicine on its own. It's 200 years old. It has a whole crazy long history. If you're fascinated by the history of medicine, go look it up. So basically it's the premise that like cures like. And so that, things that would cause a certain symptom, you can take them in an extremely diluted, minute form, and they're going to help relieve that symptom. So I think a great example is Nux vomica. It tells you kind of right in its name, Nux, like nope, and vomica, like bleh, we don't want that to be happening. So if you feel like you've overindulged, like too much is kind of the keynote for Nux vomica. So like if you have too much and you're just feeling really nauseous and overdone, Nux vomica is a great remedy. So, with that in my practice, there are 8,000 homeopathic remedies. I do not know them all. I see your beautiful law library behind you, because it's okay to have reference material.
Right.
I said that to a patient a couple weeks ago, and I was just like, ooh, that's like something I need to like have as a poster on my wall. Like, it's okay to have reference material for whatever we're doing in our lives. And so, I have many books that help me find the correct remedy for the person. There are some that are more generalized that, in combination can be really helpful for a number of different scenarios. So there are some that are great for acute musculoskeletal problems. There are some that are great if you have a cough, cold, or fever, some for allergies. So, it just depends on the person, again, like individual care, what's going on for them. And then we can help select a remedy that will support them as we use chiropractic, as we use Arvigo, as we teach some stress management, as we talk about nutrition. So again, it's just another piece of the puzzle of really supporting. And the great thing about homeopathy is that it doesn't interact with anything else that you may be taking.
Good.
So there's no pharmaceutical, like side effect interactions, where like something like St. John's wort, for example, which is a common herbal remedy that some people use for mood balancing. There's a lot of other things that you really cannot be taking at the same time if you're going to be using St. John's wort, because there are really serious side effects that can occur between those two things interacting. So I love homeopathy for that reason. So it's safe to give to pregnant people. It's safe to give to infants and newborns. You can use it for fur babies and pets. There's a whole subset of homeopathic practice that just, focuses on pets. I don't personally do a lot of that work, but, I have reference material that I can share if you want it.
Right.
And then, like you said, stress management, inflammation is driven by stress. And, I heard a great quote that like, we have a drugstore in our bodies and it's making all kinds of things every day, and the things that are making our hormones. And unfortunately, those things can't work properly because of something else that we're taking in every day, which is stress. Right. And so we live in a really stress-filled environment, and it's not stress of like, physical danger, which is what our nervous system is set up to deal with. We're dealing with information overwhelm from the phone that keeps pinging in the background, or the kid who comes home with their backpack full of papers that they want you to look at, and you already have 12 pieces of mail that you need to go through. Or the in-laws that want to do Zoom while your friend wants to be going out and doing whatever. So we just have so many things on our plate already. So stress is a huge factor in driving physical symptoms that many people are experiencing. And so stress management is for sure a big part of how I help people live their best lives. And so that can be through like I mentioned, emotional freedom technique, which is tapping, which has a ton of clinical research on it. A lot of that has been done on PTSD and anxiety, but it's appropriate for many other applications as well. We talk about meditation, mindfulness, breath work, because all of those things, again, we want to separate, right? We want to think mind and body, which we kind of already touched on, like that. As Americans, we kind of prize our brain, and like the rest of it is just guts. And so I really try and remind people like, this is all one thing. Our organs aren't just sitting inside us. They're moving all day long. Mm-hmm. Like that's how we work. And, our nervous system is constantly sending messages through those tubes so that they can all function together. And our thoughts about how that stuff is functioning or not functioning, and our stress from all of those other things that are trying to come at us affect it. And so we have to talk about that stuff if we want to help you elicit change and, move forward towards your goals.
Do you find that you work with people often who say, I don't think any of this is going to work for me? Because I feel like I am no good at meditation. No, like I try to do breathing exercises. I feel like if I sat there and tapped myself, I would just be thinking about, when is this going to be over? This isn't working. I've tried to do yoga before, and I'm always thinking about something else. Like I got to do this when I'm done with yoga. And so how do you work with someone like that who feels like they can't shut down enough to reap the benefits of those techniques?
Where we start is just with a pause, and just inviting you to like pause for a second and practicing that. Because like everything you just said, you're like going, in a million different directions at 1,000,000 miles an hour. And so in the office, and what I encourage people to do if they're like, I've tried this and this and this and this, and I just can't, is practicing pausing. Just like it's okay to have reference material, it's okay for us to stop and like just focus on taking one big breath in and letting it out. And that can be enough. Like, and I think also we're kind of obsessed with this idea of like more is better, and like finding the line of like what is enough can be really hard. And so I love giving permission slips to other people of like, this is enough, practicing this. We can work towards and have the goal of like sitting for 10 minutes of meditation, or, going through a whole yoga class or whatever. But if that seems unattainable right now, then let's start where you are. And that can just be the breath, like just taking a breath in and out. And, if your mind pops on in that breath, okay, That's fine. You can take it, you're going to take another breath anyway.
Right.
Hopefully, right? And so we always, I think that's one of the great yoga things that I've learned. You know, I avoided yoga for many years because I'm a hypermobile, flexible person, and I could get into postures that I had no business doing because I didn't have enough strength to really hold myself there, but I could get into them. And I was like, oh, look at me. And then it caused all kinds of problems. But I recently, not recently, but in the last like year, really like thought about how can I weave this back into my life. And there's some really amazing yoga people in our community. Maggie Olds owns Yoga Connect, which is over near the Lansing Mall. You know, there's Erica Kitley at Lighthouse Yoga and Massage. There's some awesome yoga folks in our community that are a wealth of knowledge and information. And one of the major premises, like if you really like look at what yoga is doing, it's not just like a flexibility, you know, workout kind of thing. It is a whole mind body system. And one of their main tenets is breath. And that each pose is an invitation to kind of pausing and letting your monkey mind go. So what if it's telling you all of that stuff? You're just going to kind of keep flowing and trying. So I love to talk about practice, that, you know, you have a law practice, I have medical practice, our kids are practicing at being humans, you know, whatever it is, like we just have to keep practicing, and then that's okay to need to practice. Yeah. So that's how I would talk to someone who is like, I've done all of the things and I just, you know, it feels like a waste of my time because I just can't. It's like, yes, you can. And maybe we just haven't found the right starting place for you. So another one of the books that we read for Battle of the Books, there's a character in it who is super frustrated. Like he wanted to be on the basketball team, and all he was good at was running back and forth on the court. Like he couldn't shoot at all. And he's really frustrated and trying to figure out like, what is he good at? And his sister says, maybe you're just playing the wrong game. And then he has this epiphany of like, oh, maybe I just need to be on the track team and just running, you know? And so sometimes I think we're just playing the wrong game with ourselves of, you know, trying to do all of the things for, you know, improving our health or whatever. And we just need to change the game of like, well, can I take a deep breath in and out and just be with myself in that, you know, 5 seconds that it takes? Yes, I think you can. And so we'll build from there.
I love it. So insightful. And it's so simple, but someone like me struggles with just the simplicity of some things. So
yes, simple does not always mean easy, right?
no, not at all. Well, thank you so much for joining me today. This has been just a lot of really amazing information. I will share all of Andrea's contact information in the caption for the video. If you're interested in any of her services, I strongly urge you to reach out, schedule a consult. If you're interested in being featured on my Fellow Friday series, you can send me an email at katrina@cornerstonelegalpllc.com. Thanks for watching.